Hi there, in this video I'm just going to tell you about some of the things you should be doing after an operation with an hypoglossal nerve implant. I'll just explain what that is first. So this is a pacemaker type device that sits here, and it has a wire that goes to your lungs that senses when you're breathing and when you stop breathing, and there's another wire that goes to your a nerve that goes to your tongue. So the idea of this implant is to help you with obstructive sleep apnea. That means when you're snoring so badly that you actually stop breathing and then you wake up very tired because the quality of your sleep is very poor. And in some people, which is what this implant's designed for, in some people it's because someone's tongue falls back. They lie on their back typically and their tongue falls back and they stop breathing, wake themselves up, or sometimes they don't realize that they wake up, but it wakes their brain up and it gives them very poor quality sleep. The idea of this implant is to stimulate the nerve that goes to the tongue. So it pulls the tongue forward. So instead of you blocking your breathing so no air can go behind it, it sort of stimulated to come forward so you can breathe behind it. And it works very well. We haven't done, it's only just started in this country, which is why I'm making this video, because not many people know about this implant in this country. So the idea of this video is to give you a little bit of information of what you should be doing after you've had your operation. And one of the most important things I want to talk about is the exercises that you should do once you've had the implant inserted. So if you remember, there's like a pacemaker device sitting here on the right hand side. This is my right hand side. And there's a wire that goes up here to the nerve which sits just about here in your neck. Now we do the operation with your neck turned like this. But we make sure there's plenty of slack. And the reason why we do that is because if you're turning your neck, you don't want it to pull on the nerve and damage the nerve. So there's plenty of slack in the system. But the problem is, what we don't want it to do is for this wire to get stuck in this position. So every time you turn your neck, it sort of pulls. And you don't want that, because if you're driving, you need to turn your neck and look over your shoulder, or you don't want to constantly feel like your neck's in a cast all the time. So after the operation, what you need to do is move your neck and make sure it heals with the ability to move your neck, so the wire can move without it getting stuck in a certain location. So what the company says you should do is do circles one way, 10 circles one way, and then clockwise and anti-clockwise like this. I'm not sure that's perfectly the right thing to do. It's easy to understand, and I guess if that's what the company says, that's what you should do. I would recommend sort of not just doing circles, but just extending and turning your neck in every sort of direction, in the extremities, so you get the best possible result. We don't want there to be any tethering or the wire coming up like this. So do move your neck like this and let the wire heal in a natural position so it doesn't restrict your neck movement later on or pull on your nerve later. You want it to all heal, because what happens is we put the implant in, that operation happens, but we don't turn that implant on. We don't actually use it for another 2 months or so. We need to let it heal in that position so there's no damage to the nerve. You don't get problems with the nerve, how it affects the tongue later on. So we need to make sure that there's no injury to the nerve, and it works really well afterwards. It needs to heal in that position. So moving around so it doesn't pull on the nerve later is really important. So these exercises should be done every day for the first few weeks until we see them again in clinic, and just make sure everything's healing well. We don't want there to be an infection or anything like that because of tugging or pulling or damaging the structures within the neck. I really hope that's useful to someone out there who not just at our department at the Royal National ENT Hospital. It may be for other people in Germany, in Australia, America, who've just had this implant, and maybe their doctors have forgotten to tell them that they should exercise so they don't get any tethering or problems with their wire. Please make sure you exercise your neck and move it around. In terms of the scar itself, the standard advice is there. You'll have some steri strips, like little plasters over it, or sometimes you have glue over this area just to let the skin heal up. Try and keep that scar out of the sunlight. I mean, the weather's great in England at the moment, but don't let it get sunburnt in that area particularly. Try and get the sun off that area because it doesn't heal very well. And once it's definitely healed, You should also sort of massage it a little bit. Otherwise, you'll get sort of hard scar tissue forming. It sort of contracts a little bit there. So massage the area, make sure it's soft and supple. And it starts off with this sort of red line there, but with time it becomes a little white line. But you don't want it to be sort of tighten up and do this to you. So it's really important that you look after your scars. There'll be one scar there and another scar across your chest. So just be careful. Try and keep it out of the sun. Use factor 500, whatever it is, and just cover this area up just to allow the scar to heal up. Scar tissue officially heals up for about 18 months. But for the first 3 months, up to 6 months, depending if it gets infected, it's really important just to look after that skin. And so the scar is as good as it possibly ever will be later on. I'll think of more things to talk about this operation, but that's it for today. I'll see you at the next one. Bye-bye.